Welcome back to Daytime, presented by Lakewood Ranch. There is so much going on in the medical community.
That's for sure, and we've asked our panel of doctors to come down to the ranch to suss it all out. We're joined by plastic surgeon Dr. Adam Scheiner and bariatric surgeon Dr. Stelios Rekkas. And welcome to Daytime, both of you.
Thank you so
much.
much.
And just to understand what a bariatric surgeon is, you are a weight loss surgeon?
Yeah, so I do surgery specifically for helping people lose weight. We do procedures like making stomachs smaller, and basically people come in, we do surgery on them, and a lot of people lose 120 pounds. So that's my specialty. I also do general surgery and different other surgeries.
Beautiful. And we know what you do.
Yes.
Facial plastic surgery.
Yeah, that's what I do.
All right.
All right.
Well, how old are you guys?
Cindy.
That's a rude question. You don't have to answer that question. But a new study from Harvard suggests hospital patients treated by older doctors in some cases may face a higher risk of death. The study performed at acute care hospitals in the U.S. between 2011 and 2014 looked at patient readmissions, the cost of care, and deaths within 30 days of being admitted to the hospital. 10.8 was the percentage among patients treated by physicians 40 and younger, compared to 12.1% among those treated by physicians 60 and older. So the question is, does your doctor's age matter, and should it matter?
Seems discriminatory.
Yeah, it's an interesting idea, because they said that younger people, I think, might be closer to their training, might be more up on the literature. And this, medicine is very interesting. These studies, they try and find differences. There is a little bit of a difference here, a 2% difference between 40 and 60.
Nothing to get excited about.
Really not. And the other thing, they found an exclusion. If people were treating a lot of patients, then it wasn't valid. So it was really the people who were older, who were not seeing a lot of patients, that were having this issue with a little bit more mortality.
Yeah, and I agree. It's that question, who do you want? Do you want the younger, sharper doctor? You want the older, wiser, experienced doctor? But the study was interesting also, that it only looked at hospitalists. It only looked at doctors taking care of patients in the acute care setting. They didn't look at ER doctors or urologists. So there was a very small difference in the percentage of difference. And I think the study's out. I think in general, doctors are like other people. You got some great younger ones and some great older ones, and there's a huge mix in between.
Yeah, sure. But I don't think people should all of a sudden, if they have an older doctor, start to question his or her abilities. Because if you have a doctor that's older, they're probably wiser, they have more experience, and that's a good thing, isn't it?
I agree.
And they can be up on the latest of everything.
Right.
Just depends on the individual. You can't judge by their age.
All right. Okay, moving on. Direct-to-consumer genetic testing. Now, this allows customers to purchase genetic analysis themselves without going through a healthcare provider. Well, that's catching on in a big way. DIY genetic tests can reveal valuable health insights, but also some health risks. In April, the FDA granted 23andMe approval to sell consumers reports that reveal their genetic risk for 10 conditions, including Parkinson's disease, late-onset Alzheimer's disease, celiac disease, hereditary thrombophilia, and a whole lot more. So, do you recommend these DIY genetic tests for patients?
These tests are very interesting. These tests used to cost tens of thousands of dollars 10, 15 years ago, and now we have companies providing them for hundreds of dollars. I think it's a great example of a little information that could be very damaging. For some people. So what these tests do, we have to look at what they do. You take a saliva swab, you send it in, and a few weeks later you get multiple pages of risks. So what they're looking at genetic predisposition. So when someone gets this risk assessment, they say, okay, you have these genes that may contribute to something like Alzheimer's or certain cancers, but what the test doesn't tell you is what your risks are. So for example, you could be at risk, but there's things not being taken into account, lifestyle, diet. So just that you have the risk doesn't mean that you're going to present with a problem. So as physicians, it's a little scary. So when people want to do these tests, I think they should do it with a doctor, so when they get the results back, although it's very interesting and it could be enlightening, they have to take it with a grain of salt.
Yeah, one of the issues that they have is that there are some things they might find that there are no treatment for. So you have to think about that ahead of time. And then it's good to share with your doctor, with your family also, because relatives might have the same genetic information you have. There might be certain risks that are shared. And then the other thing is that there are not that many medical geneticists out there, and that's, you really need guidance by someone who knows these risk factors to help you guide through these, the data that you're going to receive. So I think it can be helpful. There's certain people, if they find out they have a predisposition to heart disease. They might get into better health habits, exercise and diet and such. But I think it's better to do it under the care of a doctor.
I've done this, actually,
you?
yes. And I've got to tell you, when the results came in, I was a little afraid because I wanted to know, but did I really want to know? And being by yourself, you wonder, should I have somebody with me to look at this?
So the question is, not to get personal, but if there was something there that is, say, non-treatable,
right,
you would live with that the rest of your life.
This is true.
And maybe that would do more damage than actually knowing.
Yeah.
Right, exactly.
This was the chance I was willing to take.
And
thankfully, the results were very good.
Very good.
So.
Okay, good. Well, yeah. Good advice, docs, on that.
All right, did you know that most schools do not allow sunscreen? That's because the Food and Drug Administration classifies sunscreen as an over-the-counter drug. Florida is among 8 states with pending legislation that makes an exception for sunscreen, and at least 7 states have passed a law allowing students to apply sunscreen. Should the FDA relax these rules?
Duh.
Yeah,
that's what I say.
It is interesting because there are about, melanoma, which is one of the most deadly forms of skin cancer, about 70,000 new cases a year. 9,000 people die of this every year. And actually, it starts in these early ages of our life, right? And so I think it's important that the kids can use sunscreen. I think the issues they had were, one was the idea of allergy, that they might be allergic to something. Second, there was ideas about parents or teachers touching children and having to put sunscreen on certain areas, but I think at least maybe the kids can put it on. I think it's so important. I do a lot of things where I reverse sun damage, so I think it's so important that we protect ourselves.
Look, even if you put the sunscreen on as parents before they go to school, at least they have some sort of coating for the time that they will be outside. And I had melanoma stage 3. A lot of our friends watching know that because I do talk about it, and I talk about it not to be self-promotional about it, but to get the word out that people need to have their skin checked. They need to wear sunscreen. They need to wear several layers of it daily. And so the fact that Florida has this law is, I think, archaic.
Yes.
Yeah, and I agree. And melanoma is one of these cancers that are preventable. And what we know is that one bad sunburn as a child will effectively double your risk of having melanoma. So getting our kids protected early in school, I think, is a very important thing. I'm glad that we're talking about it and get the message out there, and parents can help, and the legislation has to get changed.
Yeah, we can all use our voices to make the
one
change.
thing is that, in the morning is great, but it does have to be reapplied.
Right.
So
Yes.
that's really the issue.
Right.
Around noontime, if they're going out for recess, they need to reapply at that time.
Okay.
And which is why this law has to be changed.
Yeah.
Okay. Health and Human Services Secretary Tom Price found himself in hot water when he referred to medication-assisted treatment for addiction as, quote, substituting one opioid for another. Nearly 700 researchers and practitioners sent a letter communicating their criticisms to Price and urged him to set the record straight. Now, what do you guys think as professionals about this statement?
It was a comment that could have been worded a little better. Again, you're taking a snippet of what's going on. These addiction patients, these patients that have these addiction to the opioids and the heroin, are a huge problem in America now.
It's an epidemic.
It really, and it's getting worse, and the government's desperate to try to fix this. So what we do with these patients is we limit their side effects. We give them other medications like methadone that helps decrease their cravings, that helps them get through to recovery. But what we find in some patients, they can get hooked on these other medications. They don't get the same high that they do with the street drugs. So the important thing is how we handle it. So we do change, and to a certain regard, get them off one drug to another, but the difference is they're on these medications under supervision of a doctor, and the point is to get them on these for a little bit, help them wean off, because watching a patient go through withdrawal is one of the worst things we could see as doctors. It's horrible.
Can only imagine.
Okay.
Yeah.
Doctors,
All right,
thank you
doctors.
both very much.
Yeah, we appreciate it. Let's do this again, okay?
Yeah.
Very good.
All right, Daytime presented by Lakewood Ranch. We'll be right back. Stay with us.
Stay with us on Daytime presented by Lakewood Ranch. We're taking you to Main Street.
This is the center of the universe in terms of events. But the first Friday of every month, there'll be a free concert here. We'll put a band at one end for the adults, DJ at the other for the kids. People are invited to bring their lawn chairs, plop them down in the middle of the street, bring their pets. Great family fun. People come from all over.